Neurofibromatosis. Background: ad hoc management of NF1 PETs between a variety of specialties. Sarcoma service sees many NF1 patients and any MPNST. There is no commission service for NF1 in Bristol. There is a commission service for NF2, AIM. To provide a commissioned comprehensive service for the management of NF1 patients in conjunction with the already established NF2 service, NF1. Neurofibromatosis 1. Previously called von Recklinghausen's disease. Common neurocutaneous condition with an autosomal dominant pattern of inheritance. NF1 has a birth incidence of 1 in 2,500 to 1 in 3,180. Diagnostic criteria for neurofibromatosis 1. NIH Consensus Development Conference 1988, 3. 6 or more café au lait macules, greater than half a centimeter in children or greater than 1.5 centimeters in adults. 2 or more cutaneous/subcutaneous neurofibromas or 1 plexiform neurofibroma. Axillary or groin freckling. Optic pathway glioma. 2 or more lesion nodules, iris hamartomas seen on slit lamp examination. Bony dysplasia, sphenoid wing dysplasia, bowing of long bone plus/pseudarthrosis. First degree relative with NF1. The skin café au lait patches and skin fold freckling. Hypopigmented macules. Juvenile xanthogranulomas. Neurofibromas. Benign peripheral nerve sheath tumors that are focal cutaneous or subcutaneous or diffuse or nodular plexiform lesions. Risk of malignant change is rare. Malignant peripheral nerve sheath tumors. 8 to 13% lifetime risk NF1 20 to 35 years. Hard to detect. Metastasize widely. Poor prognosis. Arise in pre-existing plexiform neurofibromas. Diagnostic tool, 18-FDG PET. Neurological problems, orthopedic problems, cardiovascular problems. Glomus tumors. Neurological problems. Orthopedic problems. Cardiovascular problems. Gastrointestinal problems. Psychological problems. Genetic counseling. 50% risk of passing on the condition to an offspring. Specialist NF1 clinics. The multidisciplinary team will consist of a neurologist, adult and pediatric, geneticists, including genetics counseling, and clinical nurse specialists. There are formal links to neurosurgery, adult and pediatric, spinal surgery, plastic surgery, oncology, adult and pediatric, ophthalmology, neuropsychiatry, respiratory physicians, positron emission tomography, PT, radiology, musculoskeletal and neuroradiology, pathology, peripheral nerve surgery, sarcoma units, craniofacial unit, orthopedic units. Close collaboration between NF1 clinicians will facilitate a uniform approach to the diagnosis and management of NF1 and its complications. Complex NF1 service has been nationally commissioned since 2009. The NF1 MPNST MDT should discuss the need for referral to a specialist sarcoma unit. Aims and objectives of complex NF1 service. The overall aim of the service is to provide the highest quality of care to people with complex neurofibromatosis type 1, NF1. Specifically, the complex NF1 service aims to provide specialist workup of NF1 patients with suspected complex complications of the disease, provision of accurate diagnosis of unusual phenotypes and other diseases that can be mistaken for NF1 by genetic testing and counseling, Coordinated care from a specialist multidisciplinary team when NF1 complications behave differently from the general population. Monitoring the risk of NF1-related malignancy and tumor progression. Long-term monitoring to evaluate need for surgery, for example the cervical cord. Compression group. Note: surgery, chemotherapy and radiotherapy are not covered in the designation of this national service. NF2. NF2 is an autosomal dominant neurocutaneous disease that is clinically and genetically distinct from NF1. Occurs in approximately 1 in 25,000 individuals. It is caused by inactivating mutations on chromosome 22q11.2. Characterized by bilateral vestibular schwannomas and schwannomas on other cranial, spinal, peripheral and cutaneous nerves. The nationally commissioned services for coordinated clinical care of all NF2 patients and for surgery/radiosurgery of NF2-related vestibular schwannomas. NF2 patients are at risk of deafness, high possibility of facial palsy. Visual impairment. Loss of muscle function leading to immobility. Management of patients through a specialist service minimizes the threat of these disabilities and optimizes auditory rehabilitation. The national service ensures that all NF2 patients benefit from a one-stop clinic at which they could see all the necessary specialists in a coordinated fashion. Service description/care pathway NF2. 4 centers to provide multidisciplinary clinics. Cambridge, 11.2 million, 190 patients. Guy's and St. Thomas, 13.2 million, 224 patients. Manchester, 16.7 million, 284 patients. Oxford, 9.6 million, 164 patients. The national NF2 centers are commissioned to offer specialist expertise for the main NF2 tumors, vestibular schwannoma, meningiomas, spinal tumors, and advice regarding management of other complications, ophthalmic and peripheral neuropathy. Hub-and-spoke model neurosurgical units, satellite clinics, Birmingham, Newcastle, Liverpool, Plymouth, Bristol, Sheffield, Southampton. Multidisciplinary, MDT, NF2 clinic. Consultant neurologist. Pediatric neurologist. Neurosurgeons. Pediatric neurosurgeon. ENT, skull base surgeons. Clinical nurse specialist. Neuroradiologist. Audiologist. Consultant clinical geneticist. Plastic surgeon. Peripheral nerve surgeon. Ophthalmologist. All patients are reviewed at least once a year in the MDT monthly clinic. From england.nhs.uk. Patients must be managed in line with the specification and care standards. Any deviation from these which has not been approved by NHS England is at the Trust's risk both clinically and financially. It is the Trust's responsibility to inform the Commissioners of any such non-approved deviations on an exceptional basis. Questions: is there a need for a Bristol-based NF1 service? As a sarcoma service, are we de facto NF spoke unit for NF1? Is there a regional service that looks after NF1 patients? Should we tie in with the NF2 service? Should we be commissioned, the service our service? We provide care for children and adults with complex and non-complex neurofibromatosis type 1, NF1, neurofibromatosis type 2, NF2, and schwannomatosis. For information about our children's service, see the Evelina London Children's Hospital website. NF1, NF2 and schwannomatosis are inherited conditions that have a major impact on the nervous system and can result in tumor growth. We are the UK's leading centre for complex NF1, and one of 4 national centres for NF2. We are an internationally recognized center for the diagnosis of malignant peripheral nerve sheath tumors in NF1, using PET/CT with glucose, fluorodeoxyglucose. Our neurofibromatosis specialists work across many areas. See our team page for more information. Our clinical nurse specialists support patients when they come to clinic and are also available to give advice via telephone and email. Clinical research. We are committed to the research of neurofibromatosis types 1 and 2, in collaboration with other national and international neurofibromatosis specialists. Current projects include improving the diagnosis of malignant peripheral nerve sheath tumors using methionine PET/CT. Methionine forms body proteins. Sleep disorders, a significant problem in neurofibromatosis type 1. Optic pathway glioma. We are currently evaluating the best way to diagnose and treat this tumor, which can eventually lead to blindness in some patients with neurofibromatosis type 1. Quality of life in neurofibromatosis. We are assessing the impact of complex inherited diseases on quality of life. This will help to evaluate the effect of new treatments. Support groups. Our clinical nurse specialists and psychologists run neurofibromatosis support groups for our patients and their relatives. The aim of these groups is to inform, educate and promote independence in people with neurofibromatosis. Useful websites. The Neuro Foundation website provides patient leaflets about neurofibromatosis types 1 and 2. The Children's Tumor Foundation. Changing Faces. Referrals. Routine. Emergency. 2-week wait. Neurofibromatosis team. Professor Rosalie Ferner, consultant neurologist and national neurofibromatosis lead. Dr. Shazia Afridi, consultant neurologist and joint lead for NF2. Simeon Aluko, appointments booking clerk. Sarah Cobb, medical secretary. Ms. Silva Tamian, children's senior orthoptist. Dr. Sally Barrington, consultant physician. Sonia Ciampolini, play specialist. Dr. Steve Connor, consultant neuroradiologist. Shauna Cooper, neurofibromatosis service manager. Simon Eccles, consultant craniofacial and plastic surgeon. Vanessa Everett, pediatric clinic nurse specialist. Vasant Argoda, consultant children's neurologist. Tina Hemblade, matron, neurofibromatosis team. Professor Christopher Hammond, consultant ophthalmologist. Dr. Darren Hargrave, consultant children's neuro-oncologist. Mr. Dan Jang, consultant ENT surgeon. Dr. Dragana Josifova, consultant clinical geneticist. Mr. Neil Kirkpatrick, consultant craniofacial and plastic surgeon. Dr. Karine Lascelles, consultant children's neurologist. Dr. Gaili Skzina, consultant neurologist. Mr. Jonathan Lucas, consultant orthopedic surgeon. Mr. Anthony McQuillan, consultant peripheral nerve and plastic surgeon. Rebecca Mullin, neurofibromatosis physiotherapics. Mr. Charles Ndukar, consultant plastic and reconstructive surgeon. Henry Neville, neurofibromatosis coordinator. Neurofibromatosis team. Dr. David Pang, consultant in pain medicine. Mr. Rupert Obholzer, consultant ENT/skull base surgeon. Professor Shakil Saeed, consultant ear, nose and throat, ENT, and skull-base surgeon, Dr. Alistair Sandhouse. Consultant psychiatrist, Dr. Angela Swampilla. Consultant oncologist, Dr. Atta Siddiqui. Consultant children's neuroradiologist, Dr. Adam Shaw. Consultant clinical geneticist, Mary Thomas. Deputy clinical nurse specialist, NF1, Mr. Nick Thomas. Consultant neurosurgeon, Dr. Satsuki Thompson. Consultant neuroradiologist, Jan Tusson. Nursing assistant, Dr. Sanjay Vijayanathan. Consultant musculoskeletal radiologist, Mr. Daniel Walsh. Dr. Victoria Williams. Consultant neurologist, Sue Wood. Clinical nurse specialist, NF2. Summary consultants neurologist physician neuroradiologist. Craniofacial surgeon, children's neurologist, ophthalmologist, neuro-oncologist, orthopedic surgeon, peripheral nerve surgeon, pain medicine, ENT/skull base, psychiatrist, oncologist, children's neuroradiologist, clinical geneticist, neurosurgeon. Specifically, the NF2 service aims to improve the quality and quantity of life of NF2 patients in England, to increase the number of NF2 patients with serviceable hearing by appropriate timing of surgery or radiotherapy, to increase hearing rehabilitation by appropriate implantation of a cochlear or brainstem implant, to reduce loss of function by avoidance of unnecessary surgery, to deliver high-quality holistic care through a multidisciplinary team including neurologist, neurosurgeon, clinical geneticist, ENT consultant surgeon, ophthalmologist and specialist nursing care, to provide radiological facilities appropriate to diagnosis and staging of the condition prior to planning treatment, to provide genetic testing and counseling on mutation types, to perform appropriate investigations to proceed to surgical treatment options if clinically indicated,